Hi all, welcome back to my channel iNEUROLOGIST. I'm glad to see you all here. Some of you already know who I am, and for those who see me for the first time, I'd like to introduce myself. I'm Alexander Artamonov. I'm a neurologist. This is my channel iNEUROLOGIST, where I tell people about various neurological conditions, trying to explain in a plain language what are the symptoms, the origin, so that you can get a full picture of what is going on with you. So, now we will talk about tinnitus. That is some buzzing in your head. There are much to talk about here. Most of people have heard or experienced this ringing, and they don't know whether it is a pathology, whether all people are experiencing this or not, or there are only the selected ones who hear that. There are many different situations. People in a good health really can hear this tinnitus too, but also it can appear after some earlier diseases. Now I'll try and explain what are the origins. You see, the problem of tinnitus concerned not only our contemporaries, but our predecessors as well, even long ago. Even Avicenna in the 1st century BC thought about this problem. Unfortunately, he failed to find a decision even 2,000 years ago. Then for many ages, that thing had been ignored. And a push tinnitus of understanding and finding the decision was made in the last century in 1853. The scientists Haller and Bergman ran an experiment. They invited 80 people who was absolutely well, both mentally and physically, without any illnesses. They were people of different ages, including students and other people. One by one, they were put in an absolutely quiet room, soundproofed, for 5 minutes. And then they were asked if they heard anything in there. The people did hear some buzzing in their ears. They had some sensations. Well, that was the push to the progress of theoretical and practical research of tinnitus. So, where's the origin? How does this tinnitus appear? It might be the consequence of living in our noisy world. There is always a background noise, especially in our big cities. Although there is noise even in country homes. We have a radio set on, or a TV, or some sounds outside. At least bird singing if you're in the country. The sound of a car passing by, all those background noises. We have special cells to react in such noise. Well, not cells, exactly cells, rather fibers, hair cells in the cochlea of the inner ear. These hair cells can transform a vibration, mechanical vibration, into an electrical signal, which is perceived by the brain as some noise. As a result of some huge, great noises, these hair cells may fail, which in turn may cause tinnitus. Well, this is one of the reasons. Now, tinnitus may appear because of some ear diseases. Yeah, such as earlier otitis or some other inflammatory ear disease. Even an ordinary sarin and impatiens may cause tinnitus. Also, it may be caused by some allergic reaction. Also, it might be some side effects of meds. So when you are on medication and started experiencing tinnitus, please check the instruction. If there is info about such a side effect, then if you just cancel the medicine or change to a similar one but without this side effect, and you will get rid of your tinnitus. Then, one of the causes of tinnitus is the issues with the neck of a person. So-called cervicalgia and cervical osteochondrosis also may cause such as tinnitus. And last but not the least, the cause for people over 55 might be atherosclerotic cerebrovascular disease, which leads to the development of plaque, vessels convolution, and some other changes. Tinnitus might be also a symptom of hypertension, so please check your blood pressure when experiencing tinnitus. Maybe the cause is, again, very simple, and you just need to take a pill to get your pressure lowered, and your tinnitus will disappear. That also happens in our life. Doctors used to try and treat tinnitus using various techniques. including some medical supplies. It was in the mid-80s. There were two professors, a otolaryngologist and a neurologist. They suggested a unique method of treatment to this condition. But most of their patients were over 50, and as a rule, the cause of their tinnitus was some cerebrovascular changes. So, such patients were examined and diagnosed with some changes, and they were put to the hospital. In that time, there were opportunities for such hospitalization, so they spent in hospital about 2 weeks. During that time, they got a huge vascular therapy, including 10 sessions of a pressure chamber. Then intravenous treatment with some vascular meds, antioxidative meds. They got laser therapy, acupuncture, physiotherapy, and so on. And all that for every single person. Just imagine that huge therapy. But even after all that therapy, after all that treatment, tinnitus sometimes stayed. About 20% of the patients didn't feel any progress in their condition. Later, they were put in hospital again, and even after that, some people kept hearing the tinnitus. So, as you can see, there was such a problem in the past, and the doctors failed to solve it once and for all. And if you come to see a doctor, and he or she prescribes you some medicines for reducing your tinnitus, well, in the end of the day, there is no guarantee that it will fade away. I think no. But many people will have an improvement. As you remember, 80% did have a progress, so you may be from those 80% who can improve. But anyway, I'd like to give you some hints what to do before calling your doctor concerning the tinnitus. I believe you will have to call the doctor after all. But for the first days or weeks maybe when you started experiencing the tinnitus, try to evaluate your situation first. Why did it appear? First of all, you might be just a little sleep deprived. When you go to bed late and don't sleep enough, you might get the tinnitus. If so, you can just sleep more and you won't need a doctor. Well, take a holiday, take a day off, so you could sleep longer, and if after that the tinnitus goes away, then the cause was just the lack of sleep. Then, if you're feeling some pain in your ear, or, God forbid, having a fever or some other symptoms, well, do call your doctor, please. This may be an ordinary otitis. As a result of a good treatment, you will get rid of the tinnitus. Or this may be a cerumen again. There's nothing hard. One simple procedure at otolaryngologists, and you're okay. And you will feel so much better. Then, as I had said earlier, the tinnitus may be caused by neck ache. There is a set of exercises. Please try and do those exercises. If your neck hurts and there is tinnitus, start with the neck gymnastics. But if there is no any progress in 5-7 days, then make sure you call the doctor, please. Also, there is at least 2 more exercises that can relieve your tinnitus. The first one is pressing on your ears with your hands. So put your hands on your ears and press tightly. And hold like this for about a minute. Then release. And you can do these exercises several times a day. They also can help you feel better and get rid of this tinnitus. And another exercise, it's also local. You need to do some massage behind your ears, from the bottom up. There are such dimples behind your ear. Put 2 fingers at each of them, and from the bottom up, with like this several times. So there is such a massage exercise. It also helps to reduce the tinnitus. But it is no panacea. And there is one little rule. When a person has this inner noise, it fades when there is a significant outer noise. Sometimes a person can fall asleep, and this is his or her main problem. We don't hear this inner buzzing during the day, because there are people, there is a TV working, we are working, the phone is ringing, we don't pay attention to the tinnitus. But when we are alone in a quiet room and trying to fall asleep, suddenly the inner buzzing starts to annoy us, and in this case, you will need an outer noise source in order to suppress your inner tinnitus. Nowadays, most of the TV sets, I think every single TV, has an automatical shutdown function. Let's say you go to bed at 10 p.m. You set the shutdown at 10:40 or at 11 p.m. and fall asleep with that outer noise. And your TV will automatically shut down, and you will sleep peacefully till the morning. But if you're not alone in the room and your TV bothers the other person, you can use a player. You put your headphones on and play some relaxing music. You're listening to it and falling asleep, and the player will stop automatically again, and you're sleeping. These outer sounds surpass your inner ones, so you have a chance to fall asleep, and after that, you don't care about any tinnitus. You are here, and it is somewhere else. So these little hints help you to feel better. They won't save you from your tinnitus completely, but anyway, you can live with it. That were some general advices. I didn't say anything concerning medical treatment on purpose, because every doctor has its own methods, and there are meds that can give you a bit of relief and reduce your tinnitus. There are situations when we have to prescribe some sedatives to a patient. After a course of sedative meds, the tinnitus may fade away. But again, you shouldn't make such decisions on your own, and you have to see the doctor in order to get the right diagnosis. If it is clear that there is no organic ear diseases, no inflammatory changes, no significant atherosclerotic plaque, when the patient is older, then you certainly can use all those treatments and all those exercises that can improve your condition. If we nail the exact cause, and it can be treated with medication or mechanically. If we need to remove a cerumen, then we shouldn't reject this solution either, and should go for it. So, these are my hints for you how to deal with tinnitus. I hope I made it more clear for you, and you won't be scared of this condition. Usually it doesn't mean anything bad, but it is rather uncomfortable like many other conditions. Thanks for watching. If you enjoyed my presentation, please give me your likes and please subscribe. This is the feedback that makes me feel that I'm needed, that I can help you, and I will keep doing it. Thank you.